So, good afternoon classmates. I am Myra Salipada and now we will be discussing antiviral drugs. In general discussion, antiviral drugs are medicines that decreases the ability of flu viruses to reproduce. When used as directed, antiviral drugs may help to reduce the duration of flu symptoms in otherwise healthy children and adults, and this may also reduce the severity of common flu symptoms. Antiviral drugs are both recommended for treatment and prevention of flu. These drugs work best when taken within 48 hours of onset of flu symptoms, but they may still offer benefits when taken later. These medications may reduce the duration of flu by 1 to 2 days and prevent severe flu complications. So, the drugs under antiherpetic agents are acyclovir, ganciclovir, and foscarnet. Acyclovir and ganciclovir are anti-metabolites and are needed to be activated, while foscarnet is non-antimetabolite and it is readily activated drug. Now for acyclovir is a nucleotide analog antiviral used to treat cold sores around the mouth that is caused by herpes simplex, varicella zoster, shingles caused by herpes zoster, herpes labialis, and acute herpetic keratitis. Acyclovir is generally used as first line in the treatment of these viruses, and some products are indicated for patients as young as 6 years old. The topical cream acyclovir is indicated to treat recurrent herpes labialis in immunocompetent patients like 12 years and older. Oral tablets, capsules, and suspensions form of acyclovir are indicated to treat herpes zoster, genital herpes, and chickenpox. Acyclovir topical ointment is indicated to treat initial genital herpes and limited non-life-threatening mucocutaneous herpes simplex in immunocompromised patients or yung mga mahihina ang immune system. Acyclovir cream with hydrocortisone is indicated to treat recurrent herpes labialis and shortening lesion healing time in patients 6 years and older. Acyclovir buccal tablet is indicated for the treatment of recurrent herpes labialis. Lastly, acyclovir ophthalmic ointment is indicated to treat acute herpetic keratitis. Now, for mechanism of action, because acyclovir is a prodrug, it does needed to be activated, and this involves triphosphorylation process. The first phosphorylation is done by thymidine kinase of the virus. This is needed for the virus to be converted into its active form, while the second and third phosphorylation is done by the host cell kinases. So after the activation into its triphosphate form, what it does is, first, it acts as substrate for viral DNA polymerase because it resembles the nucleotides that are normally interacting with the DNA polymerase. Second, because it does not have the 3' and hydroxyl group, so that's why it cannot be bind to another nucleotide, and thus it continues to the chain formation, and it will also cause chain termination. So acyclovir is a drug of choice for encephalitis that is caused by HSV. On oral administration, acyclovir does not have that many side effects, but in IV administration, it can cause prominent crystalluria and neurotoxicity. So, one thing that is good about acyclovir is that it is not hematotoxic as it needs the first phosphorylation from the viral enzyme. So, it cannot get converted into its active form in normal bone marrow cells. In pharmacokinetics, acyclovir is slowly, poorly absorbed from the gastrointestinal tract, and bioavailability decreases with increasing dose. It is widely distributed into tissues and fluid or body fluids. Plasma protein binding is relatively low at 9 to 24%, and the renal excretion is the major route of elimination of acyclovir. Now, the adverse effects of acyclovir includes obstructive crystal-induced nephropathy, acute kidney injury, and both can be prevented by adequate hydration and dosage adjustment. Thrombotic thrombocytopenic purpura, gastrointestinal symptoms like nausea, increased transaminases. The most common adverse effects with oral acyclovir are lightheadedness, headache, diarrhea, nausea, vomiting, and abdominal pain. The most common adverse effects associated with parenteral acyclovir are lightheadedness and anorexia. The most common adverse effects associated with topical acyclovir are mild pain, burning, and stinging. So, for precautions and contraindications, some products that may interact with this drug include other drugs that may cause kidney problems, including NSAIDs such as ibuprofen, naproxen. So, because acyclovir is very similar to valacyclovir, do not use medications containing valacyclovir while using this acyclovir. Use caution when combining acyclovir with potentially nephrotoxic agents. For pregnancy, category B or no evidence of risk in human but studies is inadequate. So let's proceed in ganciclovir. Ganciclovir capsules are used to treat cytomegalovirus retinitis, an eye infection that can cause blindness in people whose immune system is not working normally. So, ganciclovir capsules are used to treat CMV retinitis after the condition has been controlled by IV ganciclovir or intravenous. It is also used to prevent cytomegalovirus disease in people who have acquired immunodeficiency syndrome or AIDS, or those who have received an organ transplant and are at risk of CMV disease. This works by preventing the spread of CMV disease or slowing the growth of CMV. Now, in the mechanism of action, this may also use the TK enzyme, but it might not be needed. That is why it is also like acyclovir that is effective in HSV and VCV infections. But it can also be used the phosphotransferase, which is the UL76 kinase of the CMV virus. So that's why it is also effective in CMV virus. It can also be phosphorylated by cellular kinases of the host cells, and thus their side effects will be anti-cancer drug-like side effects that will cause the bone marrow suppression and mucositis. In pharmacokinetics, the absorption is about 5% of oral ganciclovir is absorbed under fasting conditions and 6 to 9% following food. Distribution, only 1 to 2% protein bound. It preferentially concentrates in CMV infected cells because cellular kinases convert it to ganciclovir triphosphate. Metabolism, more than 90% is excreted unchanged. For excretion, elimination half-life is about 3 hours in patients with normal renal function. It can be as long as 30 hours in patients with severe renal failure. The primary route of excretion is through the kidneys by glomerular glomerular filtration, and some renal tubular secretion. Now, ganciclovir may cause side effects such as nausea, vomiting, diarrhea, constipation, stomach pain, belching, loss of appetite, changes in ability to taste food, dry mouth, mouth sores, unusual dreams, nervousness, depression, sweating, flushing, and joint or muscle pain or cramps. For precautions and contraindications, pregnancy category use for US FDA, IV and ophthalmic parenteral is placed into category C. Category C. The patients with pre-existing cytopenias or a history of cytopenic reactions to other drugs, chemicals, or radiation therapy, renal impairment, pregnancy and lactation, hypersensitivity to ganciclovir or valganciclovir and other antivirals such as aciclovir or valacyclovir. So, the following conditions are contraindicated with this drug: anemia, decreased blood platelets, low levels of a type of white blood cell called neutrophils, a mother who is producing with milk and breastfeeding, chronic kidney disease stage 3A, 3B, stage 4, stage 5, and kidney disease with likely reduction in kidney function. So, proceeding to the Foscarnet. Foscarnet is an antiviral medicine that prevents certain viruses from multiplying in your body. Foscarnet is used to treat cytomegalovirus retinitis in people with AIDS. Foscarnet is also used to treat herpes simplex virus in people with a weak immune system. Foscarnet is usually given for HSV after other antiviral medications have been tried without successful treatment. So, for mechanism of action, it involves inhibition of DNA and RNA polymerase and HIV reverse transcriptase to direct inhibition of viral DNA polymerases via attachment to the pyrophosphate binding sites of the enzyme. And it is because Foscarnet does not require activation by viral kinase. For pharmacokinetics, pharmacokinetic data indicates that Foscarnet is eliminated via the renal route. It undergoes negligible metabolism and appears to be distributed widely from the circulation. However, the available data indicate that the pharmacokinetics of the drug varies among patients and within the individual patient, particularly with regard to plasma drug levels. So, for adverse effects, some of these medicines leaves the body in urine, which can cause irritation when you urinate. You may also develop sores or ulcers around your urethra or the opening where urine passes out of your bladder. So, while receiving this medicine, it is important for you to drink plenty of fluids and take care to keep your genital area clean as always. More common side effects is increased or decreased frequency of urination or amount of urine, increased thirst. The less common adverse effects: chills, convulsions, fever, muscle twitching, pain at the injection site, pain or numbness in hands or feet, tingling sensation around the mouth, tremor, unusual tiredness and weakness. Rare side effects: sores or ulcers on the mouth or throat, penis or vulva. For precautions and contraindications, the general information: Foscarnet is only indicated for use in immunocompromised patients, with CMV retinitis and mucocutaneous acyclovir-resistant HSV infections. For pregnancy, human studies regarding use of foscarnet during pregnancy have not been conducted. However, in animal studies, exposure to foscarnet was associated with a slight increase in skeletal anomalies. The safety of foscarnet in pregnancy has not been established, so it should be used only when clearly needed. For breastfeeding, according to the manufacturer, it is unknown if foscarnet is distributed into breast milk. Animal studies have shown that foscarnet distributes into breast milk at concentration that are 3 times greater than maternal plasma concentrations. Due to the potential for serious toxicities in nursing infants, breastfeeding should be avoided during foscarnet therapy until further clarification of the risk has been made. Additionally, foscarnet may be used to treat infections in patients with HIV and the Centers for Disease Control and Prevention. Recommends that in the US, HIV-infected mothers not breastfeed their infants to avoid the risk of postnatal transmission of HIV. Consider the benefits of breastfeeding, the risk of potential infant drug exposure, and the risk of an untreated or inadequately treated condition. If a breastfeeding infant experiences an adverse effects related to a drug administration to the mother, healthcare providers are encouraged to report the adverse effects to the FDA.